RFK Jr. has a plan to heal the nation. Step 1, open the floodgates for pseudoscience. And step 2, let religious extremists cash in on it. Hey, fellow skeptics, welcome back to Theocracy Watch, where we expose the steady erosion of secular governance and the rise of religious overreach.
This is Theocracy Watch.
Today's story takes us into the heart of the Department of Health and Human Services, where under RFK Jr.'s influence, conversion therapy is making a comeback. RFK Jr. has thrown his support behind exploratory therapy, a rebranded form of conversion therapy now backed by the US DHHS. Though he didn't announce it alongside his push to remove COVID-19 vaccines from the childhood immunization schedule, these moves are cut from the same conspiratorial cloth. At the center of this pseudoscience is Roger Severino, a former Trump official and Heritage Foundation fellow. Severino is a hardliner who led the rollback of transgender healthcare protections at HHS and now serves as a key figure in Project 2025, the Heritage Foundation's roadmap to install far-right loyalists across federal agencies. His vision for America is one where religious freedom means taxpayer-funded discrimination. And now, under RFK, that vision is being implemented. Severino's fingerprints are all over this policy. By framing conversion therapy as a voluntary talk therapy, his allies in the Family Research Council, Liberty Council, and Alliance Defending Freedom are gearing up for legal and financial windfall. These organizations have spent years lobbying to weaken state-level bans and are now positioned to profit off of the federal government's new classification. And make no mistake, this is a grifter's gold mine. A 2022 JMA Pediatrics estimates that conversion therapy industry generates $650 million annually in direct revenue. And when you factor in the long-term costs, right, this is like I said, this is absolutely a grifter's paradise. When you factor in the long-term costs, suicide attempts, trauma and substance abuse, the total economic burden society reaches is a staggering, get this, $9.23 billion with a B per year. Now that the HHS is removing its objections, religious counseling centers and telehealth providers stand to make even more, billing insurance, crossing state lines, and potentially dodging restrictions in states where bans still exist. Companies aligned with this ideological shift can now pitch pseudoscience as a moral good and get paid for the harm. And if RFK succeeds in removing the COVID vaccines from the official immunization schedule, insurers may stop covering them. Schools may stop requiring them, and the US could backslide into preventable outbreaks, all because one man thinks he knows more than public health experts. Our healthcare is not the grounds for a holy war. Their policies are presented as freedom, but they are engineered for control. RFK Jr. is handing the keys to the federal health agencies over to theocratic ideologues and letting them redefine reality. And the cost? Billions in public health damage, legitimized abuse under the guise of therapy, and a government more connected with faith-based feelings over evidence-based care. Once again, we're sacrificing our rights and our health on the altar of Christian exceptionalism. So until next time, continue to ask questions and stay curious. After we just talked about Colorado, I think it was, it was a couple months ago, something like that. They were arguing against the ban because there is a ban in Colorado and they're trying to fight the ban. So with this, it's just going to make it even easier for them to still utilize those pseudoscience therapies across state lines. So even if there's a ban, there's a possibility that they can make a telehealth connection or something of that sort. So to me, it feels like a huge shift of wealth from the rich, from the poor to the wealthy, because this is just going to make it, with all of the healthcare falling out from underneath our feet, the poor are going to get poorer.
Absolutely. The evil one was reading an article about this big, beautiful bill, and she was saying, if you're like the bottom rung, they are going to get squeezed.
Yeah, really bad.